We're going to start with the bump and squeeze tests. We are testing for fractures here. So the bump test is real simple. You're just going to make a little fist and bump the bottom of the heel. If there's a fracture, the vibrations caused by the bump are going to stop at that fracture site, and we'll be able to tell better where we need to evaluate. And the squeeze test is kind of the same thing. You're just going to squeeze along the sides of the leg, and the squeezing will cause pain at a particular point if there is a fracture. All right. Now we're going to move on to the anterior drawer test. This is testing for ankle sprains. You're going to support the heel in the cup of your hand, and you're going to hold on to the front of the lower leg. And as you push down on the lower leg, you're going to pull up on the heel. Notice how there's no movement here. If there were movement, we would suspect an ankle sprain. Okay? Next up is what's called the talar tilt. This one, you're going to stabilize their foot along your forearm, cup their heel in your hand. Again, stabilize the lower leg, and then you're going to rotate just the foot in and out. And because we've already tested the other side to know their normal range of motion, we'll be able to tell, okay, they're going too far or they're not going far enough. That'll determine the extent of the injury. And the last one, go ahead and flip over. Scoot down just a little bit. This one is called the Thompson test. We're testing for an Achilles tendon rupture. I'm just going to look here and see where the calf muscle starts at the bottom. I'm going to give it a squeeze, and you can see her foot moving here. That means her Achilles tendon is nice and intact. If it were detached in any way, I could squeeze this muscle all I wanted. Her foot would just continue to hang.